Welcome to the Children's Services Practice Fortnight. Here are a few words from our director, Sharon Hubbard.
It's really important that people embrace the Practice Fortnight. It's your opportunity to really be able to spend some time learning, talking, getting ourselves in a space of where we are better equipped to support our families moving forward. So I really beg you over the next 2 weeks to look at all of the topics that we're going to cover. Look at all of the sessions and try and get yourself on as many as you can. And I know some of you be sat there going, yeah, well, you haven't seen my page load. And I know we're busy. I always say this, we are busy. But actually sometimes the best practitioners, the best people to help families are the ones who just step out, give themselves some space and time to think about how and why am I going to support our families. So there's 37 events taking place. Some are face-to-face and some are online. And we're going to look at things like celebrating good practice, team and project development. We're very much going to talk about our family safeguarding model, and that will be throughout the whole 2 weeks. And I think it's really important, isn't it, that our whole theme around trauma-informed and ensuring that we are really thinking about this. This is one of our steps into getting ourselves as a borough into a trauma-informed place. We're very much going to talk about safeguarding sexual abuse, domestic abuse and stalking. And again, we've had a real increase in intrafamilial sexual abuse in Rochdale, but also nationally. And you will know that there is a national report being written at the moment by the national panel, and it's really, really important that we try to understand why have we got a rise, but also how do we support and how do we make sure that we can see the signs and that we can support and work alongside our children and families. Absolutely going to look at quality assurance and golden threads. One of the things that we've really talked about is that we need to be able to see from that really strategic high level plans that kind of people like me have to look at. Actually don't always feel like it has an impact on you every day, but we need to make sure that we are doing that. And that is how we're working. And that these high strategic plans make a difference to you and our families moving forward. We're going to talk about sexuality, LGBTQ+, lots and lots of work going on. Really proud of our youth service who got the Rainbow Award and who have been working so hard with our young people. And it's, if you ever get the opportunity to go to any of the things that we do, you really should, because it's just such a joyful place to be. And they've worked really hard to make that happen. And we're going to talk about resilience and wellbeing. I've talked about this right at the beginning. We are practitioners, we are people who work with families, but we are human beings ourselves, and we've all got our own life experiences and we've all got our own things going on. It's really important that we look after ourselves. And people will have heard me say this before. I don't celebrate overwork. I don't celebrate people burning out and not taking their leave and working to 9 o'clock at night because they think that that's going to see that the senior leaders see it. That's not what we do here. And what we do here is try to make sure that you've got that space and time. And there's lots of things going on that I think we don't always know about. So it's a real opportunity for you to look at what have we got going on within corporate that supports you to be able to support our families. So lots and lots going on, some really big pieces of work, and I really, really hope that you're going to be able to get there. The events are multi-agency, and we've got people who are leading them from children's services, managers, staffs and teams. We've got partners undertaking some of our work, and we've got a keynote speaker today, who is Zoe Roderick, and she's a registered psychotherapist, trainer and consultant. And her topic today is going to be about intrafamilial sexual abuse, the trauma response and trauma-informed practice. And just really excited to be able to think about how we bring an issue that we are all having to face, but also our absolute driver, which is that we want to be a trauma-informed borough. And so this will be a really practical way for us to think about what does that look like, what does that feel like, and how will we move forward. We're absolutely not there, we know that, but we've got a real desire to get ourselves there. Yes. Not going to go through other things, but you'll see. So there's absolutely lots and lots on the programme. Where it's purple, it's an online event. Where it's in black, it's a face-to-face event. So make sure that you get yourself to the right room on the right day, or get the link to the topic that you feel that you would like to attend. But there is a lot of work going on. Week 2, exactly the same. And again, please, people have put a lot of work into getting these sessions together. It's really disappointing when people kind of feel like they kind of say they're going and then, oh, I'm a bit busy, I'm not going to go. Please give yourself time and really appreciate the work that people have done to make sure that we can pass messages on and support you working with our families. And then at the end, we've got World Social Work Day celebration. And I can't say this, Wednesday is a shared future for transformative change. I always love World Social Work Day. You all know I'm incredibly proud to say that I've been a social worker this year, 39 years. And I still think it's one of the best professions in the world. But you can't be a good social worker without everybody around that partnership supporting and helping. So although it's World Social Work Day and we're going to have some incredible things going on that day, it is really important that we actually talk about social work as a thing that's that whole family approach of practitioners and working together make social work able to do what they can do to support families. That word. And then just, this is a bit of kind of like begging really. So we do the staff survey. It's really important. I want to know what's going well. I want to know what we think we could do better. I want to know how we can make ourselves the best service together for the families of Rochdale. That's what we get up every morning for, isn't it? We get up to make a difference to our families in Rochdale. And it's really important that you talk to us. I can't get round to every single one of you. There's so many of you. And I do love coming out. And I always say, please invite me. If you've got something going on, invite me. I want to come. I want to see what you're doing. But this is another way of us hearing from you. And so it doesn't take long, but actually the outcomes are really big. We do change things. We do listen. Brendan and Jill do an enormous amount of work on the staff survey, getting it into an arena of where we can actually make positive difference and stop doing some things, and start doing others. So please, do it. It'd be really good. And you can find the report, letters to managers, everything's on the Children's Services web portal. Having to be a trauma-informed borough. It means lots of things to lots of people, and there's many descriptions of trauma-informed. And it does come from a health background, but actually it is very, very adaptable. We know it's adaptable. We've got some incredible champions of trauma-informed in Rochdale. Hotwood Hall College, our sixth form college, just won the Queen's Award for their trauma-informed work. And they just champion our young people. They just create an environment that enables some of those children to attend college when probably that wasn't their pathway at one point. And I saw just a minute ago, Lucy Charters, our ed site, who absolutely champions within our schools a trauma-informed way of working. And we can all learn from that. And we are learning from that. So if you're not being involved in some of that work, I really ask you, when things come up, come and see how we can make a difference to families. We've got the family safeguarding model community. That will really begin to make us culturally look different at how we work with families, about how we have a strength-based attitude towards our families. And I know that we do that. But actually this really gives us that ability as a partnership to do things differently. And I was thinking about kind of where we've got to and some of the work that we've done And if you walk around the borough, you'll see our incredible family hubs have thought about that environment of families coming into our family hubs. What does that feel like walking in? Doesn't feel trauma-informed and welcoming. You've got big glass in front before you talk to somebody. You're already putting a barrier up to our families, saying that our family hubs and our workers have worked so hard. Our schools are doing incredible work to make sure that our families can come in and physically feel protected and warm and secure in the work and their conversations. It's also about a culture change, isn't it? And we are on that journey. And nobody's saying we've got it right, but we have got absolute buy-in from the police, from education, from health, from us, but also bigger than us as children's services. This is an absolute Rochdale Borough Council desire to make sure that we can support our families in the very best way. And I was trying to think of examples when I was kind of writing down. One of my examples is, so for those of you who ever come in the staff entrance at N1 and you've been up the M62 in the rain, terrible traffic, you can't get a parking space, if you know, you know. You walked from the back of somewhere because it's pouring down with rain and you're feeling like the day's already rubbish. And you walk in and Amanda on reception says, "Morning, love, how are you this morning?" And do you know what? It just makes a difference to your day. By the time you get to the lift, you've been welcomed, you've felt cared for. And she notices things like, "Oh, you're wet through, love. Where do you walk from?" And sometimes you just think, I just needed somebody to acknowledge that I'm really stressed this morning. She don't even know that she does trauma-informed work. She doesn't. It's just her culture. And we already start to see that if we all pass on that real warm cultural thinking about how do we see past the behaviour of somebody banging their swiping as they walk in the morning because they're really annoyed and kind of like they're already late for the meeting, did it? And somebody just says, "Good morning, how are you today?" It makes a difference. Trauma bomb's much bigger than that. And Zoe's going to talk to us, I'm sure, about a much more complex way of doing that. But culturally, we need to start from that basis. It's really, really important that we hang on to the fact that actually, if we are strength-based, it starts from the very moment we meet anybody. It's not when you learn why they have got trauma. You just work with people in that way. And I think the two bits that I want to finish on is that I've read lots of things and we've been doing lots and lots of work on this. But the one thing that kind of is a mantra for me is around that we show compassion and not judgment. Because do you know what? Any one of you sat looking at me at the minute could be one of our service people, and we would want to be treated in a way that enables us to be valued, to be understood, and to be cared for. And I say this all the time, you'd be bored of it, and I know that. Being kind and compassionate doesn't mean you're gullible. It means that you are a centred person that wants to support somebody else to be able to find their answers, to think about how they move forward in a way that enables them to live a life that actually means that they're as happy as they can be and doing the most that they can possibly do. So I think for me today is really important. It's one of our biggest pieces of work. There's lots of you here getting that message out. And I want you to walk away from here thinking about what does trauma informed mean in our team, in me, in our building, and that will begin to really move us forward. And we've already done lots. And I want to say thank you for embracing some of this, because I know sometimes it's not that easy.